It was a relief in a way, because we knew there was something wrong, but it didn't worry me coming because I knew it would be sort of not sorted out, but we'd know better where we stood and how things really were.
Welcome to the Memory Clinic. When you arrive, you can expect a warm welcome from our staff. You'll be met in reception and guided through to one of our consultation rooms where the process will be explained to you and you will have the opportunity to ask questions.
It first started by David going to the GP. His memory was getting poor, but he also gets quite agitated. And so the GP recommended that we came to the memory clinic.
I try and encourage people to come to the memory clinic so they can access the advice and the people and be able to live well and live longer.
Well, I can call or phone any time if I need advice.
It's good to know that you're surrounded by people who know what they're dealing with and can help, and they certainly do.
It was very funny because I was trying to say, no, we don't need that, no, we don't need that. But my daughter said, I'll have that leaflet, Maureen, I'll have that, she will look at it, don't worry.
So it is very much helping people to understand that it's better to have an early diagnosis because more can be done.
Before you come in, you may have been asked to do a brain scan. The results of this will be discussed at your appointment. You will also be asked a few questions and we will speak with you about your health. People sometimes worry about these tests, but they are only part of the overall assessment. The tests will be done at a pace that suits you and are just a way for us to measure any memory issues you're experiencing. After being assessed, we may find medication can help some of your memory problems, and we will discuss the pros and cons of this with you. Where possible, we will aim to give you a diagnosis on the same day you attend the memory clinic for your first appointment.
It's helpful to do that. By the time people get here, they're very often rather worried and have been worried particularly about whether they've got dementia or not, and I think that it makes sense for us not to then have a series of further appointments before that diagnosis is made.
Well, it's a bit threatening in a way, to feel that you're going to be under examination, psychologically, as it were. But when we did arrive, we met warmth, good people, pleasant people, and we were treated as decent, normal human beings.
She felt you could, express yourself and say anything that was troubling you.
That's right, yeah, very much so.
I can ring Maureen, I haven't needed to, funnily enough, but I know her number's there. I've got her number if I need her, yeah.
After your initial appointment, you will be given details to make a follow-up appointment if needed. We can also point you in the direction of other groups and organisations that can support you, and we may also discuss the idea of taking part in research projects. By coming to the memory clinic, you'll be receiving the best possible care, and together we can work out what your next step will be.
If anybody else was coming to memory clinic, what advice would you give them?
Oh, nothing at all to be afraid of. It's just easy peasy.